And on the coronavirus front, case counts in California top 600,000 as the CDC has projected roughly 189,000 coronavirus deaths by next month. September 5th was the date on that. So for more on this, we're joined now by Dr. Garth Walker, emergency physician at Northwestern Feinberg School of Medicine and Buehler Center of Health Economics and Policy. Doctor, we've been talking a lot about the case counts. They are on the decline. Wondering just off the top, why you don't think that we can get a handle on this crisis right now?
The reason why we can't get a handle on it, particularly right now, is we need complete buy-in from all stakeholders, and part of that is adhering to a universal mask mandate. If you look across states that do have high rates of using their mask as well as adhering to public health measures, they've been able to keep the rates pretty low down. And if we want to be able to be on the same page in terms of getting back to some form of normalcy, we have to be able to adhere to a lot of the measures that we have been advocating for recently to keep the transmission rates down. And in order for anybody to get back to their day-to-day business, they need some form of continuity. And part of that is people that may not be interested in putting on a mask, or other facets of our economy as well as the United States that are not able to do that or believe in it for whatever reason there is.
Well, Doctor, you're not the only one that supports universal mask mandates. Dr. Fauci also said in a conversation, I can't believe I'm going to say this, but with Matthew McConaughey, the actor, I never thought I would mention Dr. Fauci talking with him, but he said that he also supports universal mask mandates. Dr. Fauci, not the actor. I'm not sure what he thinks about it. I know you're saying that should be the way to go. Why do you think we can't get some sort of universal mask mandate in the United States?
I think one of the challenges is that we have been politicizing public health. Leaders in public health have been advocating for this essentially from the start. We know that if we want to be able to achieve equity, if we want to be able to protect our most vulnerable, we need people that may be in privileged situations to be able to adhere to the mask mandate, or at least a high proportion of our society putting on their mask and practicing distance from other people. And I think the politicizing of it, not necessarily adhering to science-based measures, has been very challenging for us to get our message out.
So that number that I had mentioned in my introduction to you, 189,000 deaths, is what the CDC is projecting by September 5th. So about 3 weeks from now. That means over 20,000 people would have to die essentially in just under a month. How alarming is that? I heard that number and I thought that seemed like a very large surge given where we are right now. Actually, I'm just looking at the death count right now. It's 167,528 in the United States. So that seems like a very large leap. Is that just par for the course in what we're seeing? Or when you hear a number like that, are you also alarmed that we're going to be seeing some sort of very large spike coming in the next couple of weeks?
Thanks, Kristin. I am alarmed, particularly because this is considered avoidable, right? We can put forth measures to help offset these projections. If we know that our current trend is 20,000 deaths from now, we need to get everyone online in terms of putting on a mask, practicing 6 feet distance, and making sure that we are doing our part to protect our family, our friends, our communities, people within our economy that are struggling to get their jobs going and want to get to some form of stability to some degree later. So it's more than just deaths, but at baseline, we should have enough empathy to be able to ensure that we are adhering to these measures and thinking about how we can help save each other's lives.
So the CDC also said that this fall could be the worst fall for public health. Schools are going to be reopening soon. Do you agree with that estimation that this could be the worst fall for public health? And how much do you think these school reopenings are going to play in that?
I am concerned. I'm concerned with flu season, which we have a ton of data when it starts, what happens when people take vaccines, but also the collision course of COVID. At minimum, hospital systems need to be well equipped and well aware of potential surges. So ensuring that our hospital systems are able to bear that surge with competing viruses that could be putting multiple vulnerable populations at risk, it becomes very scary. With the schools, it can be a double-edged sword. It's one of those situations where there's pros and cons. Particularly if we're talking about schools that have very high dense areas, such as public schools, schools in underserved populations that may not be able to have the appropriate ratios or the space to safely protect against transmission. But at the same time, a lot of those communities are residing, people of color and vulnerable communities are residing in regions where they rely on school for lunch, or they rely on school for childcare. So it can be very challenging, but at minimum, we need to be very intentional about how we are thinking about both communities, our most vulnerable communities, as well as our most privileged communities, in the event that they go to school as well as stay home.
All right, we'll have to leave that there. Dr. Garth Walker, emergency physician at Northwestern Feinberg School of Medicine. Thanks so much for joining us today.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.